Congestive heart failure is a condition that will affect many cardiac patients. It's something that's very common after somebody has had a myocardial infarction. We know we have the left side of the heart and the right side of the heart, and they pump to slightly different spots. The right side of the heart pumps to the lungs, and the left side of the heart pumps to the body. Pumps blood to the body. That's what I was trying to say, and crossed up some words there. So when the right side of the heart starts to fail, when the right ventricle starts to fail, the blood will back up, and if you trace a drop of blood backwards through the cardiovascular system, you know that that'll then back up into the superior and inferior vena cava. So we can see this sometimes with patients because they might have their neck veins distended, and I can't get mine to really bulge out, or they might have pedal edema, so their feet are going to be swollen. On the left side of things, if we think about the blood moving backwards or tracing it backwards, we know that it will back up into the pulmonary vein and then back into the lungs. And that back pressure on the capillaries in the lungs and around the alveoli will lead to pulmonary edema. And we can recognize pulmonary edema when we listen to the lungs because we will oftentimes hear crackles. Sometimes we hear some wheezing with it, but usually we think crackles, we think congestive heart failure. So that's right-sided heart failure and left-sided heart failure. Now, both of these could be due to hypertension, pulmonary hypertension on the right side, or just systemic hypertension on the left side, but they're more likely to be due to the effects of a heart attack. So they had part of their heart die and now it can't pump properly. So we might see different symptoms on the left side, right side of the heart. Normally, vital signs are not that far off. Your right side, your blood pressure might be a little bit low. Left side is sometimes a little bit high because they have hypertension and that's leading to it. When both sides begin to fail, we call that heart failure or cardiogenic shock. And cardiogenic shock is a life-threatening condition when somebody's blood pressure has begun to fall because the heart can no longer pump properly or cannot pump adequately. The pump itself is just tiring out, wearing out, and it can't move blood like it needs to. So these patients oftentimes will have both side heart failure. So they'll have pedal edema, neck vein distension, maybe a little bit of swelling in their hands and their stomach and abdomen might be a little swollen. Plus they'll have the crackles and ralls that we would see with left side. A lot of times they'll be short of breath. They cannot lay down. They want to sit up. Sometimes their breathing becomes worse at night, especially if they try to lay down to sleep. Paroxysmal nocturnal dyspnea, that's called. They get very short of breath when they try to exercise, or not even exercise, but just to try to get up and do anything that they used to be able to do, like walk out to get to the mail or go upstairs to a bedroom or something. They just get extremely short of breath when that happens. If we put them on a pulse ox, a lot of times their pulse ox reading is a little bit low, and in cardiogenic shock, it's oftentimes very low. So treatment for these patients is oxygen, and if we have left-sided or complete heart failure, we want to think about CPAP as long as there's no contraindications. Sometimes these patients wait so long and they become so hypoxic that they have a decreased level of consciousness and we can't use the CPAP anymore. But as long as they're still conscious, there's no signs of shock, and they're able to follow commands, we can use CPAP, and that's a wonderful condition or wonderful treatment for cardiogenic shock or just congestive heart failure. Now with congestive heart failure, if their blood pressure is still adequate and they have a prescription for nitroglycerin, we can assist them with their nitroglycerin as long as their blood pressure is adequate. Now, we're not supposed to give nitroglycerin if someone's systolic blood pressure is less than 100, so we have to be careful with that, but if they have a prescription for it and their blood pressure is adequate and there's no other contraindications, that is something that can be helpful with congestive heart failure. Now, they can have also all the signs and symptoms of someone being hypoxic, short of breath. So they're going to feel short of breath, they can have a low pulse ox reading, they might be tachypnic, tachycardic, pale, cool, clammy, or may even be looking cyanotic, and they may be getting a little drowsy or sleepy. So again, give them oxygen, keep them sitting upright. If they can tolerate, or you can use CPAP, that is good if you have crackles. Nitroglycerin is also helpful for these patients. If they have a prescription, we can assist them with that. And then rapid transport to a cardiac facility to manage it, or ALS intercept. So that's a little bit about left-sided heart failure, right-sided heart failure, complete heart failure, and cardiogenic shock.
Sorry for the change in scenery. I had a random thought as I was leaving. Forgot to mention that patients with congestive heart failure oftentimes are on a couple of medications that we'll see time and time again. One of them is called Lasix or furosemide, and a lot of our patients will call that a water pill because it makes them go to the bathroom. It's a diuretic, And because they do have to urinate so much, the other medication they're oftentimes on is a potassium supplement, because they urinate off so much of their potassium that their potassium levels get low. So you can ask your patients about being on Lasix or furosemide, and then if they're on potassium.